we are managing any chronic disease that is related to metabolic process, that is related to metabolic syndrome in terms of isolated hyperlipidemia, while managing the diabetes, managing hypertension, managing CAD, obstructive, non-obstructive, macrovascular disease, whatever we are managing. I mean, when you see the common soil is the lipid. So lipid management is the important aspect, and we know at the different time different guideline is coming, and right nowadays there is one important sentence: lower is the better. But how much lower? This is important things. Coming to important aspect, that we know that LDL is the important culprit for this development of atherosclerotic cardiovascular diseases. But this is true, and while managing the patient in day-to-day practice, LDL is not coming up to marks. While increasing the dose of statin, I mean optimizing the dose of statin, we have right now even the ROSWA also wonderful, that is with the minimizing side effect like myopathy and liver function and pleiotropic benefit with the ROSWA. But ultimately LDL is not coming up to right choice. So what is the next? How to do it? Practically, while adding sometimes estimate also not coming, and that's why very lean and thin patient without any risk factor, non-smoker, non-diabetic, they have a recurrent possibility of development of the ischemic heart disease in terms of ACS, non-ACS. So this problem is persisting. So coming to era that we have few other molecules also. One is the Bempedoic acid that is having the additive effect while adding to with the statin to reduce the LDL level, is a wonderful molecule. Other is a wonderful, that is a PCSK9 inhibitor, but that is a very expensive molecule. I have very few patients on the PCSK9 inhibitor, and they are really doing well. But expense around 20,000 in a month. I mean, really this is a big challenge in the Indian setup of patient, because most of the time we are not looking at always corporate patient. How to treat poor patients? So will we think for mass population strategy, that how to reduce the complication of ASCVD, optimize the risk and optimize the goal. So we have right now, after the estimate, that Bempedoic is the one option, and this is not looking to be very expensive molecule, and we have some definite trial that with the add-on therapy with the statin, this is having wonderful reduction in LDL level, and a few trials have shown that this causes reduction in LDL up to significant p-value also. So that no need to discuss here in the data, but Bempedoic is the one subset of molecule that having additive effect, add-on therapy with this statin in the reduction of LDL cholesterol level, that is a major culprit for development of SCVD.